name is Dr. Kibe Victor. I head the Division of Non-Communicable Diseases in Nairobi Metropolitan Services here in Nairobi County. And I will take to a brief overview of the NCDQM, that is Non-Communicable Diseases Quality Management System, which we developed from the year 2018. It was piloted in 10 facilities before being launched for use by clinicians in 4 of our sub-counties, that is Westlands Sub-County, Embakasi East, Embakasi West, and Ruaraka Sub-County. The system is available in use in 45 facilities, government facilities, private facilities, as well as faith-based institutions offering healthcare services, and specifically for diabetes and hypertension. The system was developed in collaboration with Nairobi Metropolitan Services, the German Ministry for Economic Cooperation and Development through Malteser International, and Africa Institute for Health and Development, AIHD, and IntelliSOFT Consulting Ltd. The system has unique features which helps the clinicians to adhere to the clinical guidelines that are set by the Ministry of Health. It also has features to remind the patients on the appointment dates, as well as health education on the importance of following the doctor's instructions, as well as taking their medications as prescribed. The system is also able to generate real-time reports, which strengthen our decision-making through the HMIS, that is the Health Information Management System. And it makes it easier to do the monthly reports, since the system is able to generate a monthly report which can be uploaded into the KHIS at the end of every month. So this one makes our work easier in getting the reports on time. The quality also, we are able to differentiate the reports as we would want to see them. We are able to see the patients by gender, or by age, or by the conditions they are having. We are also able to know in case there are any defaulters or patients who we've lost. And then there is also the capability of the system to auto-generate data based on what the clinicians know. Another very important feature is that the patient data is very confidential and very private. And the way the system is built is that only a clinician in a specific facility can see patients whom they are taking care of. And for that, the system is able to prompt the clinician for a username and password and some credentials. And the system can be accessed either online through the web-based platform, or offline, where we have it in an application that is downloadable from the Play Store. And the beauty of it is that other than the features is, if need be, there is usually an extensive user support through a help desk, which is run by our IT and our clinicians, so that if there are any clarifications that need to be done, or any support system, then we are able to do so. It also came in very handy during the COVID-19 pandemic. It helped us in mapping out the patients to know where they were. Of course, there were issues with lockdown and limitation of movements, but then now with the system, we were able to reach out to them through their telephone contacts, the contacts of their next of kin, so that there was no interruption of care as much as possible. Thank you.
My name is Alia Njoroge. I'm a Health Record Information Officer based at Westlands Health Center. The system that we do use at the Diabetic and Hypertension Clinic, it has a credentials whereby I log into the system. When I log into the system, I have to do a patient search when I have the patient with me, to ensure that if the patient is new, to ensure that the patient is not registered again. If the patient is new, I do a patient registration, whereby I take the patient's 3 names according to the ID, with the ID, patient, the telephone number, where the patient stays, and the treatment support of the patient together with the treatment support phone number. Each patient in the system has their unique identifier that identifies each patient so that there is no duplication of the patient, because you might find some patient shares the name. So with the patient unique identifier, they are unique. Now I search the patient again with a unique code, and it auto-generates a patient dashboard. With that patient dashboard, it gives a glimpse of the patient information. Thereby, there is the start of the patient. We have the initial card of the patient, whereby we fill in the patient details, starting with the education background of the patient. If the patient doesn't have the NHIF, we encourage the patient to have the NHIF with her to be able to help the patient in case of admission. It really saves the patient a lot. After that, we ensure that even the patient's weight, height are taken to be able to know if the patient is overweight, underweight. With those critical information, the clinician is able to know the kind of nutrition this patient needs and even the kind of medication the patient will be able to need. In the system, we have a clinical form. In the clinical form, we have initial and we have a follow-up. For the initial is where now we have the new clients who have come to the clinic, and most of their details are filled into the initial forms. After the initial form, even the drugs that they have been given, they are going to even to be told when to come back. For the new clients, we tell them to come back after 2 weeks for the revisit. With that, we are able to know if this client has any reaction with the drugs. Thanks to the system, the patient are able to receive an SMS for them to come back. For those patients that don't come back, the system is so smart that it's able to flag an alert. And even us, who we are using the system, we are able to know so-and-so is a defaulter. For the blood pressure and for the RBS, the system is able to know if this patient has an issue. In terms if the pressure is high, the system is able to flag with certain colors, so that the clinician is able even to be noticed that there is something wrong with the patient pressure or even the RBS or the FBS. For the active visits, module display the visits that are active and have not ended within the system. The system automatically closes all the visits every day at midnight. So on accessing the reports module, users encounter the report dashboard, which provides a quick overflow through the system summary task. The reports module contains the MOH 222, MOH 270 and MOH 740 register, and reports that can be downloaded from the NCD EMS and then uploaded into the KHIS after data quality assurance.
I'm Phoebe Wandema, Clinical Officer. I want to talk about how the system has helped us, especially as clinicians, in managing the clients. One, we are able to adhere to the guidelines, the clinical guidelines, because it is an inbuilt feature in the system. We are also able to be very confidential with the patient data, because it's only a clinician who can access the data through their credentials. Then a client is able to be examined wholly, because each and every system is followed. So there's a way that we can examine the clients in a systematic way. Then we're also able to know the number of clients that we see in a day, because it's through the system it generates it. And we can also be able to follow up on clients who have defaulted, who have missed their appointment, and who are supposed to be visited at home.
My name is Florence Kamau. I'm the chairperson, Diabetes and Hypertension Campaigners. where we are housed here in Westland Health Center. This is where we come for our clinics every Wednesday and every Friday. And this system has been very, very helpful since 2018 when it started. And whenever we have issues with our members, the clinician is able to help us trace our members. And also even those who are very, very vulnerable, the clinician, because he or she is the one who listens and knows the problem of the patient, he or she is able to help us trace our member, even those who are defaulted, those who are not adhering to medication. So it is a very good system. And whenever our members don't come, it also reminds them of their clinic. It sends messages to them telling them that your clinic is due this day. So it has been a very, very helpful system, and we appreciate the continuation of this system.
So far, the system has assisted us in terms of downloading of the reports and helping us to even upload it to the KHIS, which enables us in terms of decision making. We are able to know which cohort is affected by diabetic and hypertension, which helps in decision making in commodity purchase when maybe we request from KEMSA, and even the community pharmacy is able to know which commodity is going off shelf so much that they are able to purchase depending with the number of clients that we have. The system itself has enabled us to have good documentation, whereby even when, let's say, the system is down, when I mean the system is down, maybe that time there's the network issue or the lights are off, we are able to go manually, and even through the manual we are able to retrieve the patient file, and the patient will still be seen by the doctor and the clinician, and later on we are able to backdate our data to the system.
I would like to thank all the stakeholders who've put in efforts to make the system work. We appreciate that, like any other system, we are continuously engaging and learning more. We intend to improve on the features that come with it, so that at one point we are able to move around with the patient's record.